Dallas County Health and Human Services Director, Dr. Phil Huang. Doctor, thank you so much for your time. As Xavier pointed out, Texas has the most cases right now. So how dire is the fight in keeping it from spreading from county to county and beyond?
Well, this is, I think, the largest outbreak and largest number of cases we've seen in Texas in 30 years. So it's obviously, an extremely urgent situation. I mean, this huge population out in West Texas, many unvaccinated. So as we get to spring break, as was mentioned, the travel and things, certainly other communities like ours are worried about that spread.
So what advice are you giving to Texans right now and anybody who's planning on traveling there? I mean, are you telling people not to travel, or what's your guidance?
I mean, the advice is really pretty simple because we have a really effective vaccine that's worked for decades. Make sure you're up to date on your vaccinations. And that's really the simple thing to prevent this. If you get, the 2 doses are 97% effective.
Yeah, I know that a lot of different states are kind of working in tandem right now to curb the spread. What kind of support are you getting from the federal government, and what more do you need, sir?
Sure. Well, I do understand, there's a CDC team on the ground in West Texas, and so that's certainly greatly appreciated by the community. And other state resources are also going to support things. But, this is really, it's a big outbreak. There's like a community of 25,000 out there.
Yeah, it's frightening. And families everywhere have this on their radar. DOJ continues to slash departments that directly impact millions of Americans' health care. They're making cuts to agencies like the CDC that's directly involved in stopping the spread of an outbreak such as this. How worried are you by that, Doctor?
Well, definitely, the support from CDC and some of these other federal agencies is very critical for us being able to respond. And also that the funding streams, are really critical for us to be able to maintain protection for these situations. So absolutely. And I know we're looking at, what are the scenarios if there's these significant funding cuts?
Yeah. Also wanted to take your temperature on this, the fact that RFK Jr., who's, of course, the new Secretary of Health and Human Services, is touting these alternate medicines, including steroids, vitamin A, cod liver oil to treat or prevent measles. Is that an effective plan? And what do you make of his comments?
No, I mean, it's really concerning to distract from the primary veer from that or diminish or weaken that message. And so, some people will do some of these alternative practices instead of getting the vaccine. And we really want to make sure the vaccine is the primary message, getting that and being up to date.
Yeah, and we've talked and heard time and time again about herd immunity, how important it is in keeping an outbreak like this from spreading. What advice do you give to parents who may be on the fence or nervous about their kids getting the MMR vaccine?
It's been around since the 1960s. It's millions of people have had it. It's safe, effective. It's why we were able to say that measles was eradicated in the United States in 2000. And so it works. It's safe. It's effective. And this is how you can protect yourself.
Thanks for watching. Go to joinnn.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.